about a topic that the title, Where Next for Prevention in a Changing Drugs World.
Okay, thank you very much for that kind introduction, and it's really a pleasure to be here in Cyprus, my first visit to Cyprus, although I arrived very late last night, but the street lights looks very nice. I'm also a proud European, so I won't make too many jokes about Brexit, but I hope that the UK will see sense and return in a not too distant future. I can but hope. So, I'm actually going to start off with a summary of my key points, because I only have 10 or 15 minutes for my talk. And we're in a strange situation with regards to prevention, particularly drug prevention with young people, that we've spent many years trying to develop the field and try to develop the science. But in many cases, we've achieved quite a lot of things in that area, but the world itself has changed around us, and I do think that many of the prevention activities that we've developed and deliver don't accurately reflect broader scientific understanding or the broader drugs world. And that's not meant to be a negative criticism, it's an observation. So we've heard from Alexis, and we have a very interesting session this afternoon, that we know that the drugs people use are changing and how they use them are changing, although there are still some commonalities which I'll refer to in a moment. More importantly, and something which I'm particularly interested in, is that our understanding about how drug use and substance use manifests and what consequences that has also changed. And I don't think our prevention programs are accurately reflecting this. And I'll talk about that very briefly. Technology is changing, so this is technology not just with respect to drug production or drug markets, but how we deliver our prevention activities. And for many of us developing prevention programs, I don't think we're actually using the right technology and the right engagement techniques. And I'll say something very briefly around drugs policy and policing, because again, we have a very interesting session tomorrow morning about alternatives to punishment. And this is something I'm particularly interested in with regards to how drug prevention and drug education can be provided as an alternative to punishment. So this is just some data from the SPAD survey of 15 and 16-year-olds. So we're awaiting the 2009 report, but this is just data from Cyprus. And this is just to reflect that across Europe, we have very, very different patterns of substance use. So here in Cyprus, for example, relatively low levels of cannabis use, but quite high levels of alcohol use compared to the European average. If we're in the United Kingdom, we would see much higher levels of cannabis use. We would potentially see much higher levels of new psychoactive substance use. So we must reflect and recognise that patterns of drug use are different across European member states, but quite often our prevention programmes are orientated almost towards a European norm, a standardised approach. So that's one of my points about let's think about the changing drugs element. Now, still acknowledging that, I think it's important to recognise that still the main drugs of concern for young people are cannabis and alcohol. Increasingly in many European countries, and as Alexis mentioned, certainly not to the same extent as in the United States and North America, I think there's a growing understanding about the role of prescription medicines and misuse of prescription medicines and other synthetic drugs. And I have to say that our prevention response to this type of substance use is very, very underdeveloped. Most of our activities in this area are around weaning programs, dose reduction programs, or prescription monitoring activities. We don't really have any prevention programs around this. Cannabis policy is changing. We can't help but acknowledge this. In Luxembourg, for example, probably the first European country which will move to a legally regulated cannabis market. And I do suspect that other European countries will follow within the next 5 to 10 years. But really interestingly, none of the prevention programs or education programs that we've developed around cannabis have reflected this reality. Most of the content of many prevention programs around cannabis reflects a more primary prevention, prohibition-orientated approach. So we need to ensure that the cannabis prevention programs we're delivering are reflecting this changing policy. European prevention in general does face some significant challenges. Now, I won't go into these in too much detail, but I mentioned before that prevention science has been developing, and we know a lot more about what prevention programs work, and I'll say a bit more about that later on. More importantly, we know which approaches don't work, but we have a real issue with implementation of effective programs. And there's many reasons for that, and Pierre was talking about some of those. And a lot of this is around the advocacy for prevention. Now, I do a lot of work in harm reduction and treatment, and these are essential responses to drugs issues. But for too long, prevention has almost been seen as the Cinderella discipline. And this hasn't been changing. And this has also been reflecting in funding decisions and the priority we see around prevention in some of our national drug policies. I sometimes think that the attention to prevention in national policies can sometimes be tokenistic and is often not matched with resource and activities that governments provide. That's just my personal opinion. And if we think about prevention, so if we ask many people, well, what do you understand by drug prevention? Well, quite often you might say, well, it's to stop people from using drugs. It's it's to reduce the harms from drugs, prevent escalation of drug use. Well, actually, no, our definition of prevention has become a bit more sophisticated. And I actually think that prevention is about understanding how behaviours such as substance use manifest and how that interacts with other risks and adverse outcomes. Prevention interventions are identifying those common determinants, those common pathways to risk and harm, and intervening at those key points. And this requires a subtle shift in the way that we think about prevention. And because I'm from a public health background, I often think about our approach using, for example, the socio-ecological model of health. And this encourages to actually understand individual behaviours, individual health behaviours, which include substance use, and to understand the individual as part of a broader system. And Alexis was talking about this. So when we think about why behaviours manifest and what the consequences of those behaviours are, we need to move beyond those individual level determinants, which a lot of prevention programs actually focus on, to better understand how environment, how relationships with significant structures and organisations, plus national policy and economic context, also determine those individual level behaviours. I think this is a really important concept. And if we look at substance use from a developmental perspective, then quite often, as we can see here in the yellow boxes, substance use is almost a final outcome of many previous steps, of many previous opportunities to intervene. And actually, for many individuals and groups, substance use can be seen as an indicator of a broader cluster of issues and problems. And too often, prevention activities are focusing on these outcomes that we see here in yellow, regardless of rather than focusing on some of the important determinants of this. And the reason why I think this is important is because we know that a lot of these early behaviours and risk factors are also responsible for poor mental health, issues around crime and vulnerability. So by focusing on these common risk factors, we can have a bit more of an influence. And this is seen in a lot of work which has been done around adverse childhood experiences. And adverse childhood experiences are co-occurring family events which cause chronic stress. And work done in the United Kingdom, for example, suggests that young people, children who experience multiple adverse childhood experiences are 10 drugs and look at the determinants of substance use. But this is, of course, is an ideal. This is a utopia. This is not reflected in how we actually deliver our services at the moment. So drug prevention is certainly one component of our response to risk, but it's only one aspect. And quite often, these services and activities are disparate, and this is often reflected in our national policies, which are fragmented. But I do think there are encouraging signs in several European countries where they're trying to develop combined and coordinated substance use policies, bringing together different substances, bringing together different mental health and social care services, for example. And this is because prevention is everywhere. Prevention is not just activities which take place in the classroom or in the police station. Prevention should be seen as an activity which can be delivered in all aspects of community and life. There's still a role for prevention programs. In my discussions here, I'm not trying to say that we shouldn't pursue prevention programs, and we have the EMCDDA's Prevention Registry Exchange, and I highly recommend you have a look at this. But just to remind you that you may be disappointed about the evidence for prevention and what effective programs for prevention we actually have. And I think we need to think beyond the delivery of these manualised programs because we don't have a lot of evidence in that area. Just very briefly to talk about technology. So this is the Climate Schools program. This is an Australian schools-based prevention program, and it's had some positive effects on cannabis use and ecstasy use. And it uses an interactive web-based comic and graphics, and it's a good program. But very, very limited engagement, very, very limited reach. Compare that, for example, to the Ministry of Health in the Netherlands, their Drugs Lab program, which many of you might have heard of or seen. So this is a YouTube channel, millions of subscribers, and every week the presenters of the Drugs Lab program take drugs on camera and talk about their experiences and talk about education and harm reduction. Now that's very controversial. I appreciate that. That's very controversial. But the levels of engagement that this YouTube channel has is something which traditional prevention programs can only dream of. So are we using the right sorts of platforms? Are we using the same right sorts of techniques? And Fiona Measham this afternoon will talk about drug checking in nightclubs and festivals. And again, I think this is a perfect way to engage people in order to subsequently deliver prevention. Now, just very quickly, because I'm aware that we've run out of time. Again, tomorrow morning we have a session on this. And so increasingly in countries across the European Union, we're interested in different ways to divert people away from the criminal justice system when they broke drug laws. And in Cyprus, I know that there is a law on the legislative books, but it's not enacted. And oh, great! Well, that's really good news. I'll update my slide. And we quite often think of these sorts of programs for people who use heroin or crack cocaine, diversion into treatment. But actually, there's an opportunity really early on in the criminal justice process, right where people are arrested by the police, to divert people into education and prevention. And I think that this is a really good opportunity to prevent escalation of problems. Now, I'm very mindful of time, so I'll have to stop there, but I'm here all day, so more than happy to talk about this further. So thank you very much.